Assignment 16, Human Immunity, by Courtney Park. The immune system is responsible for defending the body against infections, diseases, and foreign invaders that can cause harm. It is a complex network of cells, tissues, organs, and molecules that work together to protect the body. What is an infection? An infection is a process where pathogens such as bacteria, viruses, or fungi invade and multiply within a host organism, leading to an immune response. Infections can occur in any part of the body and can range from mild to severe. Depending on the type of pathogen, the host's immune system response, and other factors such as the age and overall health of the host, infections can be transmitted through various means, including direct contact with an infected person or animal, contaminated food or water, or exposure to infected surfaces or objects. Proper hygiene and vaccination are essential measures to prevent and control infections. Defences against disease. The immune system has 3 lines of defence, each of which plays a crucial role in protecting the body from pathogens. The first line of defence is the non-specific defence system, which includes physical and chemical barriers that prevent pathogens from entering the body. These barriers include the skin, mucous membranes, and secretions such as tears and saliva. The skin is the largest organ in the body and provides a physical barrier that prevents pathogens from entering the body. The mucous membranes line the respiratory, digestive, and urinary tracts to provide a physical barrier that prevents pathogens from entering the body. Secretions such as tears and saliva contain enzymes that destroy pathogens. In addition to the physical and chemical barriers, the non-specific defence system also includes cells such as phagocytes and natural killer cells. Phagocytes are cells that engulf and destroy pathogens. Natural killer cells are cells that recognise and kill infected cells. These cells provide a rapid, non-specific response to pathogens. Inflammation, fever, and the role of macrophages are all important components of the body's immune system response to protect against infection and disease. Inflammation is the natural response to infection or injury, and it involves the activation of immune cells and the release of chemical signals called cytokines. These cytokines cause blood vessels to dilate and become more permeable, allowing immune cells and fluid to enter the infected or injured area. Inflammation helps to contain and eliminate the pathogen, but it also causes symptoms such as redness, swelling, and pain. Fever is another response to infection in which the body's temperature is raised to help fight off a pathogen. Fever occurs when certain immune cells release chemicals called pyrogens, which act on the brain to raise the body's set point of temperature. The increased temperature can help to inhibit the growth and replication of the pathogen and activate other immune cells. Second line of defence. The innate immune system is the second line of defence against pathogens. It provides a rapid, non-specific response to pathogens. The innate immune system includes cells such as neutrophils, macrophages, and dendritic cells. Neutrophils are the most abundant type of white blood cells and are the first to respond to an infection. They engulf and destroy pathogens. Macrophages are large white blood cells that engulf and destroy pathogens. They also produce cytokines, which are signalling molecules that activate other cells of the immune system. Dendritic cells are specialised white blood cells that recognise and present antigens to T cells. The innate immune system also includes molecules such as complement proteins and acute phase proteins. Complement proteins are a group of proteins that work together to destroy pathogens. Acute phase proteins are proteins that are produced by the liver in response to inflammation. The adaptive immune system is the third line of defence against pathogens. It provides a targeted response to specific pathogens. The adaptive immune system also includes cells such as T cells and B cells. T cells are white blood cells that recognise and kill infected cells. B cells are white blood cells that produce antibodies, which are proteins that recognise and bind to specific antigens. The adaptive immune system also includes memory cells. Memory cells are long-lived cells that remember the specific antigens that their body has encountered in the past. The memory allows the immune system to mount a rapid and targeted response to a pathogen that the body has encountered before. Acquired immunity, also known as adaptive immunity, is a type of immune response that is specific to a particular pathogen, such as a virus or bacteria. This type of immunity is different than innate immunity, which is the body's general defense system that responds to any foreign substance. Acquired immunity works by recognizing and remembering specific pathogens that the body has been exposed to before. When the body encounters a new pathogen, specialized T cells called B cells and T cells recognize and respond to it by producing antibodies that bind to the pathogen and mark it for destruction from the other immune cells. There are two types of acquired immunity: humoral immunity and cell-mediated immunity. Humoral immunity involves the production of antibodies by B cells, which circulate in the blood and lymphatic system and can neutralize or eliminate pathogens. Cell-mediated immunity involves the activation of T cells, which are directly kill infected cells or activate other immune cells to eliminate pathogens. Acquired immunity can be naturally acquired, meaning that the body develops immunity after being exposed to the pathogen through infection or vaccination. Vaccines are a form of active immunization that stimulate the body's immune system and produce a protective immune response without causing disease. Acquired immunity can also be artificially acquired, meaning that it is transferred from another source, such as through the injection of antibodies from an immune individual, or the transfer of immune cells or tissues from one individual to another. One of the most fascinating aspects of the immune system is the ability to recognize and distinguish itself from non-self. The immune system is able to recognize and attack foreign invaders while leaving the body's own cells unharmed. This process is known as self-recognition. However, sometimes the immune system can malfunction and attack the body's own cells. This is known as an autoimmune disorder. There are many different types of autoimmune disorders, including rheumatoid arthritis, lupus, and multiple sclerosis. In autoimmune disorders, the immune system mistakenly attacks healthy cells. Organ transplantation. Organ transplantation is a life-saving procedure where a healthy organ from a donor is transplanted into someone who has a sick organ. For example, if someone's kidney is not working properly, they may need a new kidney from a donor. When an organ is transplanted, the body's immune system, which protects the body from foreign invaders like germs and viruses, may see the transplanted organ as a foreign invader and attack it. This is called rejection. Rejection can happen in different ways and at different times of the transplant. To help prevent rejection, doctors give patients medicine that lowers their immune system so that it doesn't attack the transplanted organ. This medicine is called immunosuppressive drugs, but taking these drugs mean that the patient has a higher risk of getting infections and other health problems. To make sure the transplanted organ is working properly and to catch any signs of rejection early, patients need to see their doctors regularly for checkups and tests. They also need to take their medicines exactly as the doctor tells them to. It is important for patients and their families to have support and resources to help them manage their health after a transplant. This can include counselling and support groups to help them cope with the stress of taking medicine and the risk of rejection. With proper care and adherence to medication regimes, the risk of rejection can be minimised and patients can lead healthy and fulfilling lives after a transplant. Lupus. Lupus is a chronic immune system autoimmune disease that can affect various organs and tissues in the body. In autoimmune diseases, the immune system mistakenly attacks the body's own tissues, causing inflammation and damage. The symptoms of lupus can vary widely from person to person and may include fatigue, joint pain and swelling, skin rashes, fever, chest pain, and sensitivity to sunlight. Lupus can also affect the kidneys, heart, lungs, and nervous system, leading to more severe complications. The exact cause of lupus is not fully understood, but it is believed to involve a combination of genetic, environmental, and hormonal factors. Women are more likely to develop lupus than men, and the disease often develops during childbirthing years. Diagnosis of lupus typically involves a combination of blood tests, imaging studies, and evaluation of symptoms. Treatment may involve medication to manage symptoms and prevent organ damage, as well as lifestyle modifications, such as avoiding sun exposure and managing stress. Although there is currently no cure for lupus, with proper management and care, many people with the condition are able to lead full and active lives. It is important for individuals with lupus to work closely with their healthcare providers to develop a personalised treatment plan and monitor their symptoms over time. Rheumatoid arthritis is a chronic and autoimmune disorder that primarily affects the joints. In rheumatoid arthritis, the immune system attacks the lining of the joints, causing inflammation, pain, and eventually damage to the joint, cartilage, and bone. The symptoms of rheumatoid arthritis can vary from person to person, but commonly include joint pain, swelling and stiffness, and particularly in the small joints of the hands and feet. Other symptoms may include fatigue, fever, and weight loss. Over time, the damage to the joints can cause deformities and loss of function. The exact cause of rheumatoid arthritis is not fully understood, but it's believed to be involved a combination of genetic and environmental factors. Women are more likely to develop rheumatoid arthritis than men, and the disease often develops in middle age. Diagnosis of rheumatoid arthritis typically involves a combination of physical examination, blood tests, and imaging studies such as X-rays and MRI scans. Treatment may involve medications to manage pain and inflammation, as well as disease-modifying anti-rheumatic drugs to slow or stop the progression of the disease. In some cases, surgery may be necessary to repair and replace damaged joints. Although there is currently no cure for rheumatoid arthritis, with proper management and care, many people with the condition can lead full and active lives. It is important that individuals with rheumatoid arthritis work closely with their healthcare providers to develop a personalised treatment plan and monitor their symptoms over time. Acquired immunity is the type of immunity that develops over time as a result of exposure to various pathogens, vaccines, or other immune-stimulating substances. There are 4 categories of acquired immunity, including natural immunity. This is the type of immunity is acquired naturally without any external intervention, such as through exposure to an infectious agent. For example, if you get infected with a virus, your body might develop natural immunity to that virus, which can protect you from future infections. Artificial immunity. This type of immunity is acquired through medical intervention, such as through vaccination or immunization. Vaccines contain weakened or dead forms of the pathogen or its components, which stimulate the immune system to produce a protective immune response. Passive immunity. This type of immunity is acquired through the transfer of antibodies from one individual to another. For example, a baby can acquire passive immunity from its mother through breast milk, which contains antibodies that protect the baby from infections. Active immunity. This type of immunity is acquired through the activation of the immune system in a response to an antigen or pathogen. This can occur naturally through exposure to a pathogen or artificially through vaccination or immunization. Overall, acquired immunity is an important mechanism for protecting the body against infections and diseases. By understanding the different categories of acquired immunity, individuals can make informed decisions about their health and take steps to protect themselves from infectious agents. Immune response to vaccinations. Vaccines work by triggering the body's immune system to produce a protective response against a specific pathogen or disease. When a vaccine is given, it contains a small amount of a weakened or dead form of the pathogen or its components, which are recognised by the immune system as a foreign and potentially harmful. The immune system responds by mounting immune response, producing antibodies and activating immune cells such as T cells and B cells, which work together to eliminate the pathogen. This process can take several days or weeks to complete. Once the pathogen has been eliminated, the immune system retains a memory of the pathogen and the immune response that was mounted against it. This is known as immunological memory. If the individual is exposed to the same pathogen in the future, the immune system can mount a faster and more efficient response, thanks to the immunological memory that has been established. In this way, vaccination provides long-term protection against infectious diseases by training the immune system to recognise and respond to specific pathogens. The development of the immunological memory is a key aspect of the immune response to vaccination, as it allows the immune system to provide a rapid and effective response to future infections. Herd immunity is a concept that describes the indirect protection of individuals in a population from an infectious disease. When a large proportion of the population becomes immune to a disease, this can occur naturally through widespread infection or artificially through vaccination. Vaccination programs are an important tool for achieving herd immunity, as they provide individuals with protection against specific infectious diseases. When a large This can ultimately lead to the eradication of a disease in a given population. However, the effectiveness of a vaccination program is dependent on vaccine uptake, or the percentage of population that receives the vaccine. Factors can impact vaccine uptake. Benefits of vaccination. Vaccine hesitancy. This refers to the reluctance or refusal to receive vaccines due to concerns about their safety, efficiency, or potential side effects. Lack of access. Some individuals may not have access to vaccines due to geographical, economic, or social barriers. Misinformation. False or misleading information about vaccines can lead to confusion and uncertainty among the public, which can reduce vaccine uptake. Cultural or religious beliefs against infectious. Some cultural or religious beliefs may discourage individuals from receiving vaccines. To achieve herd immunity and ensure effective protection against infectious diseases, it is important to address these factors and work towards increasing vaccine uptake in populations. This can involve education and awareness campaigns, improving access to vaccines, and addressing concerns and misinformation about vaccines. Vaccination provides several benefits for individuals and populations, including protections against infectious diseases. Vaccines are designed to provide protection against specific infectious diseases by triggering the immune system to produce a protective response. This can help to prevent illnesses and reduce the risk of complications associated with the disease. Herd immunity. Vaccination can contribute to herd immunity, which provides indirect protection to individuals who may not be able to receive vaccines, such as those with weakened immune systems. Eradication of diseases. Vaccination has been instrumental in the eradication of several infectious diseases, such as smallpox and polio. Cost effectiveness. Vaccination is often more cost effective than treating diseases that can be prevented through vaccination, as it can reduce the need for expensive medical interventions and hospitalizations. Reduce the spread of disease. Vaccines can reduce the spread of disease by making it more difficult for infectious agents to circulate in the population. Overall, vaccination is a safe and effective way to protect individuals and populations against infectious diseases, has been responsible for the prevention of countless illnesses and deaths, and has contributed to public health around the world, improvements around the world.